Good day to everyone. Thank you for tuning in to yet another interview cruncher. This time around, in celebration of the International Breastfeeding Week, we are focusing on nourishing our future, addressing malnutrition through breastfeeding. Breastfeeding plays a prominent role in furthering SDGs 2 and 3, which include ending hunger, improving nutrition, and promoting health and well-being. It's one of the critical pathways to reduce under 5 mortality. Breastfeeding Week provides an invaluable opportunity to highlight the essential connections between maternal nutrition, breastfeeding, and the long-term health of both mother and child. This interview cruncher aims to shed light on the critical role of maternal nutrition in promoting successful breastfeeding and optimal infant nourishment. And to do so, we have three prominent speakers joining us today, and I will be introducing them, and they will be sharing their insights around this topic, and we will be following that up with a question and answer session. Our first speaker is Dr. Sabiha Sultana, who is a program manager at GAME Bangladesh, and she's also joined by Mary Jerry, who is director at the Global Hunger Response at World Vision International. And we also have Dr. Anita Gupta joining us, who's a national level expert in breastfeeding related trainings. Dr. Sabiha, if you can address the question, what are the key nutrients that breast milk provides, and how is nature supporting mother and baby through breastfeeding? Thank you.
Thank you, Lubet, and it's a great pleasure to meet the fascinating panels. I'd like to share how amazed I was when I first saw the baby can find by its own where the mother's breasts are just after delivery. I didn't know the reason that time, but I know now. By drinking baby drinks amniotic fluid during pregnancy, and the colostrum, that is mother's first milk, smells and tastes just like amniotic fluid. When the mother holds the baby in her arm just after delivery, the baby actually can smell the colostrum and finds its similarity with amniotic fluid and go towards the breast. I find it really amazing. Now comes to the nutrient. Is it only nutrients that the mothers are concerned and the family members are concerned? I think their expectation is much more. If anyone can share some of the examples from their experience of what are the expectation the mother and the family members have?
Usually the mothers are not concerned about the breastfeeding. Actually, they are concerned about all family members also concerned about that. She is so tired. She has gone through such a agony of labor pains, and the milk is also not there. The breasts are empty. How can we give the nutrient to the baby from that breast? So they think they should be given something else to the baby from outside. That can be a formula milk or any other milk. So that's their concern mainly, rather than giving their breast milk. I
Uh,
think so.
thank you, Dr. Gupta. I find when the baby is born, the first thing that comes in mother's mind is the baby is so small, how I'm going to handle this baby, especially for the first who is experiencing the motherhood for the first time, how I'm going to feed him properly, whether I'll be able to produce sufficient milk or not, whether the milk that the baby is drinking, whether it will provide sufficient nutrition, or as you have mentioned, whether she should go for the formula feed that the people around them are suggesting, or just simply just why my belly is still so like large. It feels like I'm having another baby inside when it's going to come down and I have a natural abdomen. And when all these things are sorted out, I think mother feels like really tired. They can sense if they can have a like complete good night's sleep after all this, handling all these pressures. If you think about the nutrition of the breast milk, for first 6 months, the breast milk actually provides all the necessary nutrients to the baby, which is essential for the baby. But after 6 months, they need some supplementation as per WHO guideline. The breast milk actually contains sufficient nutrient for example, carbohydrate, fat, protein, lactulose, vitamins, and minerals. Most importantly, like calcium, zinc, magnesium, iron, omega-3 fatty acid. Like, you also know that people are really worried about because babies are frequently affected by GI problem or other lung diseases like acute respiratory infection. So breast milk not only secretes the nutrient, it also secretes the antibody which mother's body produce. I think this is more or less everybody knows, but what is the amazing thing that everyone may not know is breast milk can actually act as a medicine. It's called speed backwash theory. Like, when a baby gets sick, when the baby's saliva goes back to mother's milk, and that signals to mothers to produce immune boosting cells and antibody for baby to the next batch of breast milk for the baby to drink. Breastfeed baby has less chance of developing common illness, obesity, diabetes, and like they have a less chance of developing asthma, allergies, lung disease or air disease, sudden infant deaths, etc. So apart from this, there is another natural mechanism, like during lactation, mother's areola is enlarged and they have Montgomery gland. It seems like pimple, but it actually lubricates and disinfectant that keeps the germs away. So this is how nature is actually protecting the baby with a natural process. And the breastfeeding process is actually really exhausting for the mother. So mother need to take rest, and how nature is actually supporting that process. The breast milk actually contains higher concentration of nucleotide, which is secret at nighttime only. Not nighttime only, the concentration is higher at night. So when the baby is fed at night, it makes them sleepy and they have a good sleep. So if a mother can pump the breast milk and use that high concentration nucleotide breast milk to like use that for another day, and someone else can feed, mother can actually take rest. And apart from this, like mother can also get benefit from the breastfeeding. Like it significantly reduce the postpartum hemorrhage. And there is also uterus can get to normal size. There is less chance of development of uterine, ovarian, breast cancer, as well as low risk of developing diabetes and heart diseases. I want to conclude with one thing, one of the fact that milk is actually like act as a living food. It constantly changing from feed to feed, day to day, month to month, based on the nutritional need of the baby and condition of the mother. So there is no supplementation or replacement of the breast milk and breastfeeding. Thank you all.
Thank you so much, Dr. Sabiha. Nature is indeed a miracle. And yet again, as you shared with us, it is evidenced in breastfeeding. We will now move on to our second speaker, who is Mary Jerry from World Vision. And I will ask Mary to share with us in what ways policy interventions and community initiatives contribute to creating supportive environments that enable breastfeeding mothers to access nutritious food and improve maternal nutrition outcomes.
Thank you very much for having me in today's very critical discussion on the topic of breastfeeding. And this comes at a time when women and girls are facing a very huge challenge in access to nutritious food, which is one of the barriers to breastfeeding. And the reason for this is the ongoing global food and nutrition crisis that is affecting millions of people, including mothers and girls. And I want to say that statistics already show that 69% of girls and women suffer from micronutrient deficiencies. And a latest study by UNICEF shows that the number of acutely malnourished, breastfeeding, and pregnant mothers has risen by 25% in 12 of the most affected countries by the food crisis. And so in light of this crisis and the challenges that are affecting women, mothers, my organization, that's World Vision, is implementing a global hunger response. And our goal is actually to reduce the acute food insecurity for the most affected communities. And one of the objectives for us to be able to achieve this is by increasing access to preventive and curative health and nutrition services, and for the most affected and vulnerable groups. And this includes pregnant and breastfeeding mothers, as well as children under 5 years. So for us to achieve this objective, we are focusing on policy interventions as well as community initiatives. And on policy interventions, I would like to say that we are doing a number of things. First, knowing that policy interventions create an enabling environment for breastfeeding mothers to be able to access nutritious foods and also to improve maternal and nutrition outcomes. So some of the things we are doing, first, we are partnering with multiple stakeholders, and this include governments, include UN agencies and donors, to expand coverage of essential nutrition services through community outreaches. And this provide free services to women at community level. And actually we go an extra step of even like moving the services from a health facility level to do things like mobile outreaches that go to the nearest, closest to the people most in need, so that women are able to get like micronutrients supplementation, screening for malnutrition, things like deworming and other such services. Secondly, we are promoting social protection for mothers and girls. And this we do in all our cash transfer projects, and ensuring that as we target those people that are most in need in these times of food crisis, food and nutrition crisis, we ensure that the mothers, these breastfeeding mothers, those that are pregnant, those with children under 5 years, are among the first to be prioritized for any cash transfer. And this enables them to use that cash to get nutritious foods for their families. That is that we are using multiple channels to communicate vital information on nutrition and care practices, knowing that information and knowledge gaps is also one of the barriers to good maternal and child health. So this is also something we are doing. We use multiple channels, sometimes working with community groups, such as what we call the community health workers, peer educators, to ensure that this information is available even at a door-to-door basis, and then to follow up that these mothers are actually using this information to be able to nurture their children well. In regard to community initiatives, I'd like to give 2 examples that are very innovative and really working for us in different communities. The first one, in Sierra Leone, we partnered with Emory University, with the Ministry of Health there, and worked together to target grandmothers in a project that we identified that grandmothers play a very crucial role in influencing, advising, and also giving care to young mothers before, when they are pregnant, and even after childbirth. And so we realized that the information they have and the attitude will then also determine how they support these mothers. So after 3 years of working with them, ensuring they have the right information on topics such as infant and young child feeding, exclusive breastfeeding, and among others, we could already see a turnaround of how they understood and then the change in the application of that information. For instance, before our partnership, the grandmothers we worked with them, 50% of them believe that children should be given water within 6 months of birth. But after working with them, we saw this number decrease very much to less than 2%. And this is very good because they are then able to now promote exclusive breastfeeding. And we all know the benefits that this comes for the children. In Kenya, we are using an approach called mother-to-mother care groups that brings together pregnant and breastfeeding mothers. And this is a platform for them to learn different information, get knowledge on how to take care of children, have health talks on different topics. And some of the things we discuss here like the infant and young child feeding and nutrition. And using this information, then they are able to utilize it at household level and apply it in their children. And because they are now in a group, this provides a supportive environment for them to share experiences, to discuss how the challenges they are coming up with and how they can be able to handle them. And not only that, but we also use these platforms to teach them skills. It can be on cooking, how to best cook the food so that it retains its nutrition value, and also other skills such as how to start small businesses, how to do better farming. And because of this, and with the support that comes with it, they're able to grow nutritious foods for their families, to start income generating activities that can bring an income, and they use that money now to meet the needs, food needs for their households. So this becomes a platform where they learn, they try new things, they make an income and can support their family. So it's holistic and not just looking at one area, but also addressing multiple barriers to breastfeeding. So you would like to ask, why do we do this? So as World Vision, we believe that breastfeeding is a powerful tool in combating malnutrition, reducing under 5 mortality, and also promoting child health and nutrition. And we have seen from statistics, like from the World Health Organization, that optimal breastfeeding can save up to 820,000 lives of children annually. So we said this is quite something that we need to support as we work on ensuring that children develop to their full potential. And not just saving the lives, but ensuring that they develop again to their full potential and are able to be productive in their communities, in their households. And this leads to development in the whole society, including their nations. So thank you for this. And I believe that as we continue dialoguing on this issue of breastfeeding, we are going to get the speed that we need to support women address the barriers that affect breastfeeding. Thank you.
Thank you so much for that, Mary, and for shedding light on the data that does say a lot about where we are in terms of child health and well-being. And of course, thank you for sharing the comprehensive program that you are working on. I trust the fact that you highlighted and focused on, making information available at all levels, at community level, at different stakeholders level is quite critical in terms of ensuring that we get the right support and the right decisions and actions are taken. So we will come back, of course, at the end with some follow-up questions. But for now, let's move on to our third speaker, Dr. Gupta. So my question to you today is, so if you can tell us about, what the key nutrients and dietary considerations for mothers are during the breastfeeding period to ensure optimal nutrition for both them and their infants, and how can we assess the growth of the infant? Furthermore, if you can also shed light on how maternal nutrition impacts the quality and composition of breast milk, and what implications that has for infant growth, cognitive development, and immune system strength. Thank you.
So today I'll be talking about how does maternal nutrition impact the baby's growth and the development. As we all know, the first 1,000 days, it's really a critical window. So what this 1,000 days are, like starts from the pregnancy, the first day of the pregnancy, as well as till the 2 years of the age. So at this period, the baby is at the greatest vulnerability that leads to stunting, growth, and development. So maternal nutrition foundation is the foundation stone for child's growth and development. Fetal growth restriction is one of the leading risks of stunting and contributing to 1/4 of newborn babies' death. It builds a baby's brain and fuels their growth. It improves child social readiness and educational achievements, reduces maternal and infant child mortality and morbidity, and it also boosts a country GDP as much as 12%. And this maternal nutrition only breaks the intergenerational cycle of poverty. So much importance the maternal nutrition during the pregnancy time. But let's see once the mother comes after delivery. Next slide. and she is into postnatal period. Let's see when the stunting starts. It starts during preconception. So we see that preconception only the stunting starts, and it's apparent at 8 week of pregnancy. That's the first trimester, and it peaks at the 20 weeks of gestation, and the weight velocity peaks at 30 weeks. That's third trimester. And if we don't take care of the mother's nutrition during this period when she is pregnant, that gives birth to low birth weight babies. And we know the low birth weight babies are really vulnerable for the death and mortality and morbidities. So it's very important that we take care of the maternal nutrition while she is pregnant, and even we should start thinking about the preconceptional stage also. So let's see about the breastfeeding. So, how does maternal nutrition impact the quality and composition of breast milk? It's been seen, and many studies have shown since now that the balanced diet for lactating women is essential for providing psychological needs of the mother as well as for the health of the baby or the infant via ideal quality and composition of the breast milk contents. But still, literature and many studies now show that maternal nutrition status and dietary vitamin and or mineral supplementation mainly influence milk concentration of vitamin A, D, B12, thiamine, riboflavin, pyridoxine, etc., iodine and other minerals, whereas the milk contents of protein, carbohydrates remains unaltered unless the mother is extremely undernourished. So it's very important that the mother is properly given the micronutrients for the breastfeeding period. A study in Latvia on lactating women also concluded that macronutrients like fat, proteins, and lactose content in human milk is not affected by maternal diet. A study again says that macronutrient relationship in infant anthropometric measurements by Egypt shows that to improve breast milk composition, one could aim for improving the nutritional balance in lactating women, especially for protein intake. So this is again coming that protein intake has to be good. Someone say multivitamins or micronutrients has to be good for having a good quality of maternal milk. Another study also says that high intake of red meat, cereals, and eggs are associated with higher protein, total dry matter, and energy contents in the breast milk. So these things do help, the studies are showing. Again, it's another study says that non-vegetarian, vegetarian, and vegan mothers produced breast milk of the comparable nutritive value. So again, there's no difference between a vegetarian and non-vegetarian diet on the breast milk production and the quality. But still we need the need of the hour is the more well-designed longitudinal studies about factors that influence human milk compositions are needed. So we can now conclude that if mother is taking appropriate balanced diet of all the macronutrients and the micronutrients, she can produce enough milk and offer good quality for her baby. So now we talk about the growth of the baby. So we all know the breast milk is the best for the growth of the baby. It is a tailor-made for her baby. The carbohydrate, proteins and fats, minerals and vitamins present in breast milk is ideal for development and growth of the baby. Breast milk contains lactose and not sucrose or starch, which is easily digestible by the young baby. And other milk and milk products contain starch, which is not digestible by the baby. And also this high lactose content, what it does, it produces acidic pH in the stomach, and which prevents growth of the harmful bacteria. So let's infections to these babies who are breastfed. Human milk contains an enzyme called lipase, which digests fat in the breast milk more completely, and thus fat is efficiently used in by the baby's body to give a better growth to the baby. Similarly, breast milk and colostrum contains plenty of vitamin A, which boosts immunity and also good for the vision or the eyes. Iron present in breast milk is absorbed well, so prevents anemia in the baby till 6 months. Many formula people have tried to fortify the formula with the iron, and they claim that the formula has got that much amount of iron as in breast milk. But it's been seen that the absorption is less from the formula milk. And secondly, if the more amount of iron is added in that, it leads to growth of harmful bacteria, which causes infection to the baby. So this is the best thing which the breast milk gives for the good growth of the baby. If we talk about the cognitive development, we all know breastfeeding provides measurable advantages in cognitive development seen in infancy and persisting. It's been seen that it persists throughout childhood to at least 15 years. Many studies saying that. And the breastfed babies have additional 5 to 8 IQ points higher than the formula based babies. And it's now, this benefits more in low birth weight infants also, which are preterm or low birth. The breast milk contains DHA, which is absorbed well, and it is very much essential for myelination of the brain and helps in enhanced cognitive development. Again, the formula company wanted to claim that they are fortifying the formula with DHA, but again, the absorption is poor and it's not been utilized properly. Many observational studies have demonstrated nutrients important for neural development are polyunsaturated fatty acids and micronutrients like iron, folate, zinc, etc., which are present in breast milk. Many studies are coming up with saying that longer breastfeeding durations were seen associated with mean cognitive score higher than the mean cognitive score of those who were never breastfed. So here are the certain two studies, like follow-up study of 3 years and a millennium cohort study in UK. They all say that the positive correlation between breastfeeding duration and mean mental development index. And another study also says that the cognitive scores at age of 5, 7, 11, and 14 years were really associated with higher cognitive score depending upon the breastfeeding duration and association. Another study by Manuel says a data of 47 preterm infants also says that early breastfeed exposure modifies brain connectivity in preterm babies also. Another review says that importance of human milk and oligosaccharides in neural development preterm and how they again review also focuses importance human milk and oligosaccharides in neurodevelopment in preterms and how they prevent neonatal complication and thus contribute to increased preterm survival also. So these oligosaccharides present in breast milk are really helping baby to grow in cognitive value as well as their survival is also improved if they are started breastfeeding early exposure is given to them. Now we talk about the immunity. It's really breastfeeding. We all know it boosts the immunity of the baby. And it's been seen that for the first year, a baby immune system is not fully developed. And so they cannot fight infections as an older child or an adult. So a baby needs to be protected by his mother. And the breast milk contains white blood cells, a number of anti-infective factors like immunoglobulins A called secretely immunoglobulins, lysoenzymes, and which are secreted within the breast into the milk. And in response to the mother's infection, whether it's a previous infection to the mother or it's a current infection, these antibodies do come to the baby's body and they produce the immunoglobulins antibodies protection to the infection. So let's see what's the mechanism of protection against infection. So when the mother gets infected, the white cells in the mother's body make antibodies to protect her. And some of these white cells go to her breast and make antibodies there. And these antibodies are secreted in breast milk to protect the baby. So babies are really protected by these antibodies passed to the breast milk. So breast milk is not just a food for babies, it's a living fluid which protects a baby against infection. Colostrum produced for the first few days following birth is particularly rich in antibodies. It's the first immunization for the baby. Breast milk has probiotic factors also to support the immune system, and it also serves as a nutrient source for healthy bacteria in body called the human microbiomes. The healthy microbiomes can play a lifelong role in not only preventing infection, but also in decreasing the risk of allergies, asthma, obesity, and other chronic diseases like heart disease, diabetes, etc. So the importance of breastfeeding we cannot deny. The breast milk contains anti-infective proteins like lactoferrin, which binds with iron and prevents the growth of bacteria, and lysosomes also, which kills the bacteria, as well as antibodies, immunoglobulins to fight with the infection. Other important anti-infective factors present in the breast milk is bifidus factor, which also promotes or inhibits the growth of the harmful bacteria. Breast milk has also been containing antiviral and antiparasital factors, as we saw in COVID-19 also. The viral antibodies were present in the breast milk, which were protecting the high dangerous disease to the babies. If we talk about the low birth weight babies, someone says not to start the because they want to gain the weight fast, but still it has been seen that breastfeeding prevents many things like hypothermia, hypoglycemia, other metabolic derangements. It protects from sepsis and necrotizing enterocolitis because of the immunoglobulins, erythropoietin factor, etc. in the breast milk. It optimizes growth and development of these preterm babies and also reduces the mortality in the preterm. So we must start the breastfeeding within 1 hour as early as possible to combat and to get these benefits of the breast milk. Next, if we have to talk about the health care professionals, what the role they have in breastfeeding, it was told by uh, Mary Nigeria also, by Mary also, that they are doing some project also. But the why where we health professionals are required. So they are required during the counseling of antenatal period when the mother is pregnant, counseling at the time of birth to start the breastfeeding within 1 hour, then about the checkups, routine OPD checkups, immunization visits. Then again in the special circumstances like when she's coming with some uh, breast conditions like mastitis, cracked nipples. So everywhere, and the counseling in the community also. Once she goes to the community from the health setup, so to sustaining exclusive breastfeeding for 6 months and continuing for 2 years and more. So everywhere there's a very important role of healthcare professionals in starting as well as in continuing the breastfeeding for 6 months and more. We all know the magical first hour is the golden hour, and we all know the critical what is the importance of this hour. If we start within 1 hour, 22% of mortality of the newborns is uh, decreased. Many more, the decreases the newborn stress level, improves mother newborn attachment, it encourages breastfeeding also. So it has to be started within 1 hour, and our health professionals should work on this lines. Many studies have also show like breastfeeding advice during antenatal care is a very good intervention for promoting the breastfeeding. And a Cochrane database study also says that professionals breastfeeding support increases initiation as well as exclusive breastfeeding till 6 months. So first step to initiate and maintain successful breastfeeding is help of the health professionals when the mother is delivering in the institution. So why we are not able to do it? Because we are not skilled people are not present in our setup. They don't know how to counsel. They don't know what how to help it. Then many times the WHO breastfeeding hospital initiative has not been taken. Hospital practices are not that good where the mother is delivering. So we have to take care of all these things if we want mother to start breastfeeding and also family support. So family support is also important for initiation as well as for continuation of the breast feeding along with the health professionals care and the support. Now, once the mother, we have a breastfeeding support at the hospital, we have good breastfeeding hospital initiative, still the professional should coordinate discharge so that parents and their infants have timely access to ongoing support and care. That is the mother support group, the grassroots workers like Anganwadi workers, ASHA, ANM. So we must tell them how to uh, go about it, who will be there to help them. So all these health professionals, and then again the health professional at the grassroots level should be trained in doing the counseling and helping these mother in the agony. So Ministry of Women and Child Development programs for MIYCN, there are many programs are launched like Saksham Anganwadi and Poshan 2.2 period to 21-22 program for the MIYCN challenge tackling. Then Pradhan Mantri Matra Yojana Vandana, Vandana Yojana in 2017 to support pregnant and lactating mothers with the financial support. Janni Shishu Suraksha Karikram, which was launched in 2011 year, and which gives mother, entitles the pregnant mother antenatal delivery, complication care and treatment of sick child till 1 year, which is absolutely free in public health in India. Then there is a mother's absolute affection program for promotion of breastfeeding and complementary feeding. So there is a convergence of health as well as the women and child development department at the grassroots level in India, and where the health and ICDS workers, they work together for the nutrition and health of the mother, the education, health checkups, supplementary nutrition, and referral services. Thank you.
Thank you, Dr. Gupta, for that comprehensive insight into the key nutrient and dietary considerations for both the infant and the mother, as well as for highlighting the role of health professionals and giving us an overview of supportive regulatory frameworks around this. So with that, we move on to the Q&A session, and I hope given that you've given us quite a comprehensive information, all three panelists, I hope you can take a couple of questions as a follow-up. I would like to surface one topic, which I think we need to cover here as well, and that is around the role of employers in terms of creating or contributing to creating a supportive environment for mothers who wish to continue to breastfeed once they are back at the workplace.
Allow me to take it, and I believe that the rest of the panelists will, of course, come in. So I know that employers have a key role to ensure that women, first of all, have access to their maternity leave once they are pregnant. And I know that there are different periods given by different governments for women to be able to access their leave. And so an employer, even while a person is already pregnant and coming to work, should ensure that they have first the time to go for the antenatal care clinics, because this is very important for the children, as we have had in the different presentations. And also when the time comes for delivery, that they can go in good time so that they can be able to access a health facility for them to deliver. And then that they are able to get their full period for maternity with their child, so they can have this time for breastfeeding. And there should not be any reason why somebody should be recalled from maternity leave before their time is up. And one other thing they can help is that even I have seen employers that even when a person comes back from maternity leave, like the organization where I work, you're given some additional consideration. For instance, where I work, you're given an hour earlier. You can go home earlier, 1 hour, so that you can be able either to go for lunch hour and breastfeed the child, but also that you can either go early in the evening so that you have time with the child. They also provide facilities within the workplace where you are able to express the milk and keep it, so that the regular flow of the milk can be there for you, and that the child can have this access to this milk even while you are away at work. So I'll stop there and let my other panelists come in. Thank you so much.
I would like to add few things. Very good, Mary. You have given the insight of working women help, or how we can do the employers. Only thing is one more thing they can do, that instead of the full-time job, they can be switched off to the part-time job. So till they are breastfeeding their babies after the maternity leave. Employees can have crèches in their workplaces, so the mothers can keep their babies there, and they can be given some leave for half an hour for every 3 to 4 hours, so that they can feed the baby at the same premises. That will become easy for the mother to do. Secondly, they can be made part-time workers instead of the full-time, so that they have to spend only 3 or 4 hours and then they can go home. And work from home also can be done in such scenario if it permits, her work permits. So these things can also be done by the employee if they want mothers to help in breastfeeding. Thank you.
I want to add just one more point. Mary has already mentioned in detail what are the steps that we can take in workplace, I just want to mention that we need to make social behavioral change so that in every sector, everywhere, it is incorporated as a kind of behavioral change, so that everyone accept that it is very natural thing, not as an extra support or extra benefit given to the women just because of this. So I think those, if we can change those viewpoints over time, that will really help, like to create a appropriate environment for promoting breastfeeding.
Indeed. Thank you all so much. That was quite insightful. And I must say, it does still feel like this is a privilege that is given to women, whereas it should be the norm for every employer. And maybe moving on to my last couple of questions. This one is a point I believe that comes in different conversations around breastfeeding, and I would love to hear your point of view on this. The first one is around, how long should a mother breastfeed? And in a way related to that, when should a mother avoid breastfeeding? Are there any counter indications that you believe should be taken into consideration?
Mother should continue breastfeeding for 6 months exclusively, and what the Ministry of Health and WHO says, and she should continue breastfeeding for 2 years or more if she wants. So that's the period she should continue breastfeeding. And secondly, what are the contraindications and when she are not supposed to breastfeed her? There are only few contraindications, only one or two which I can say. That is anti-cancerous drugs if mother is on. But still nowadays, if she is on breast cancer drugs, again few drugs are coming which can be given with the time period when the baby is not fed for 24 hours, express breast milk is left. But still we say that if the mother is on anti-cancer drugs, as well as if it's in a radioactive substances. Otherwise, they have to be little vigilant if taking any normal drugs. Not much contraindications are there. She has to be vigilant if she is taking anticonvulsants like epileptic drugs or antipsychotic drugs, that the baby is not getting sedated. Otherwise, normal drugs she can continue, and rest, nothing, no conditions are there where she has to stop breastfeeding.
Just to add one thing, it's better to discuss with the medical doctor before taking any drug during lactation, because some of the drugs actually get secreted in the breast milk. So, and one drug has a specific duration than other. So getting the suggestion from a medical doctor is good before taking any medication, because as there are number of safe drugs that can be just replaced with the regular drug that is regularly used. So just need the suggestion from expert.
Thank you so much, Dr. Gupta and Sabiha, for that. I fully agree on the need for the 6 months exclusive breastfeeding, and then trying to sustain breastfeeding for at least 2 years, more if you can, because I have personally seen it really very beneficial when I've done that as a mother, and that really propels children in all ways in their development. So it's really something that we should be able to uphold as children, as parents. Thank you.
Thank you all so much for your inputs and your insight on the different topics. I think we go away with quite a number of critical messages from the conversations we've just had, and it's really great to see, breastfeeding is indeed a powerful tool in combating malnutrition, reducing under 5 mortality, and promoting child health and well-being, as was just presented and highlighted by some of our speakers. At the same time, I really appreciate the emphasis that was given around the maternal nutrition, which directly influences the quality and composition of breast milk, which is vital for the infant's growth. So the focus on a well-balanced maternal diet is quite critical, a critical point that you have raised. Furthermore, as just reflected on, breastfeeding mothers do face challenges, whether it's limited access to nutritious food, whether it's a lack of knowledge or the right information about appropriate dietary choices, or just about around time constraints. So being cognizant of that, whichever roles that we play, whether, as mentioned earlier, whether as a grandmother, whether or any community member, whether as an employer or any influencer in the policy landscape around this, is quite critical to kind of have the mother's point of view and the challenges that are faced by the mother around this. And definitely, the high-level policy interventions complemented by community-based initiatives do make a difference, as was just shared with us from the examples of the projects that are run by World Vision. So I'm really thankful to all of you for your time and for candidly sharing your insights on this topic. And to our audience, thanks again for joining us at the International Breastfeeding Week and tuning into the Interview Cruncher. You can watch more of such videos by going to our website, gainhealth.org. You can also follow us on our social media to see more of such videos coming up. Thank you.